In this module, I'm going to be talking about endodontics, chapter 54 in your book. But before we get too much into it, I do want you to have a good understanding of what it is that you're going to be learning about. So thinking back to DEA 121 with medical terminology, if we take our word endodontics and break it down, we have our prefix endo pertaining to inside, our word root dont pertaining to the tooth or teeth, and then we have our suffix ix pertaining to the knowledge of, treatment of, practice of. So if we put that all together, what we have is a knowledge, practice, treatment of what's inside the tooth. So if you think again back to 121, where you learned all about the anatomy, the structures of the teeth, the outermost layer surrounding the coronal portion of the tooth is known as the enamel. What's surrounding the root of the tooth is known as the cementum. We have our dentin, which comprises majority of the tooth, and within that dentin is the pulp. And within the pulp we have the pulp chamber, which is located in the coronal portion of the tooth. And then we have our radicular pulp, which is going to be located in the root, if it's a single rooted tooth, or roots if it's bifurcated or trifurcated. So endodontics is going to be dealing with the diagnosis, the prevention, and the treatment of not only the dental pulp, but also the periradicular tissue that is going to be surrounding the root. With endodontics, it's going to be looking at a couple different causes of pulpal damage. And the first cause can be known as physical irritation. And physical irritation is going to be extensive decay or decay that has been left untreated. It's gone from the enamel into the dentin and then has invaded the pulp and has caused infection, which can then lead to an abscess, and an abscess is a localized infection caused by the bacteria from the decay or the cavity that has been allowed to sit in the tooth for a long period of time. Another type of irritation or cause for pulpal damage is going to be trauma. And trauma can be in the form of getting hit in the face. Maybe the person played some sort of a contact sport or even got hit in the mouth with a baseball or a softball, a basketball, a football, a volleyball, whatever it is. Potentially, falling and hitting your mouth, a car accident, any kind of blow to the mouth can cause trauma, as well as biting into something incorrectly. Maybe you were eating popcorn and bit into a kernel, which actually fractured or broke your tooth. And then I've mentioned before that anytime we're doing any kind of a restoration to a tooth, whether it's a filling or a crown, we're having to remove tooth structure, and that removal of tooth structure also creates trauma to the tooth. So make sure you know what the different symptoms are when it comes to pulpal damage, because there's going to be symptoms that patients are going to be experiencing that can be an indication that damage has been done to the pulp. So make sure you have an understanding of that.